from Batch 101, and for today's video, we're going to tackle the facial shaving. And for our assessment, we have to review general physical assessment findings, determine patient's ability to shave his own face. If unable to shave his own face, find out who usually assists him. Then, we have to assess method for shaving patient's face, like in bed or in chair. And we also have to determine patient teaching needs regarding facial shaving. And for our objectives, we have to render necessary assistance in shaving the patient's face. We have to refresh the patient and to promote self-esteem. And here are our equipments. We have the basin of warm water, towel and face towel, aftershave lotion but it's optional. We have safety razor or electric razor. We have shaving cream or soap solution, tissues, and cotton balls. And for our first procedure, we have to wash our hands. Then, we have to wear gloves. We have to wash our hands to prevent the spread of microorganisms. And then for our next procedure, next is explain the procedure and its purpose to gain the cooperation and to ease the patient anxiety. Good morning, sir. I'm Lizelle. I'm your caregiver for today. I'm going to perform a facial shaving for you. Is it okay with you, sir? So now, let's gather all the things, but the things must be on the bedside so that it's easy to access the equipment to have no delays. And for our evaluation, we have to evaluate the patient's face, chin, and neck are clean. Then patient is comfortable. Shaving is accomplished without discomfort to the patient. Place the patient in a comfortable position to prevent muscle strain. Sir, are you comfortable with your position right now? Okay. Now, spread the towel under the patient's chin to protect the gown from soiling. Let's start shaving your face, sir. Comfortable, sir? Okay. Place a warm washcloth over the client's face for a few seconds, followed by an application of shaving cream or leathery soap. Makes the hair softer and easier to remove in order to prevent pulling, scraping, or cuts. But first, I have to test the temperature of the water. Oh, okay. I'm gonna put this one, sir, on your face to make it for you to feel comfortable. Okay? With a finger on one hand, stretch the skin taut as you shave in the direction of which the hair is growing. Hold the razor at about 45 degrees angle to the skin and use short firm strokes and avoid the chin and lips. Longer strokes on the longest areas of the face. Start under the sideburn and work downward on the cheeks. This is to avoid causing discomfort or razor cut, and following the direction of the hair growth is to prevent skin injury. Rinse the razor frequently. Rinsing is to remove the hair and the abstract from the blade. Next, we have to wash off the remaining soap after shave. A soap that is left on the skin may cause irritation. Inspect the hair after hair removal. Ensure hair is safely removed. No scraping or cuts have been made. Apply aftershave lotion as the patient prefers so that the patient will feel cool and relaxed. Sir, would you like to have aftershave lotion? Clean your equipment and put it in its proper place. Discard used disposable supplies and equipment appropriately to prevent spread of microorganisms. And for general considerations, client prone to bleeding should use an electric razor. Those receiving anticoagulant or high doses of aspirin or those in low platelet count. Check for frayed cords or other electrical hazard when electric razor is used. Electric razor is not recommended in patients receiving oxygen. Electric razor should be used only one client because of infection control consideration. And that's the end of my video. Hoping that you've learned something. See you on my next video.